How does estrogen affect the menstrual cycle? Imagine your body as a finely tuned orchestra, with hormones like estrogen acting as the conductors guiding each movement. Estrogen is a key hormone that plays a vital role in regulating the menstrual cycle, influencing everything from the growth of ovarian follicles to the health of the uterine lining. It works closely with other hormones such as follicle-stimulating hormone and luteinizing hormone to keep the cycle running smoothly. At the beginning of the cycle, during menstruation, estrogen levels are low. This drop triggers the shedding of the uterine lining, which is what causes bleeding. As the cycle progresses into the follicular phase, follicle-stimulating hormone stimulates the ovaries to develop several follicles. The dominant follicle then starts producing increasing amounts of estradiol, the main form of estrogen during this time. As estradiol rises, it signals the uterine lining to thicken and regenerate, preparing a lush environment that could support a pregnancy if fertilization occurs. This phase, called the proliferative phase, is when the endometrium becomes more vascular and glandular under estrogen's influence. As estrogen levels peak toward the end of the follicular phase, they send a message to the brain to release a surge of luteinizing hormone. This LH surge triggers ovulation, the releases of an egg from the dominant follicle. Just before ovulation, estrogen levels briefly dip as the follicle stops producing as much estradiol. This hormonal shift is what prompts the egg to be released and marks the middle of the cycle. After ovulation, the ruptured follicle transforms into a structure called the corpus luteum, which produces both estrogen and progesterone. During the luteal phase, estrogen continues to help maintain the thickened endometrial lining, keeping it ready for a potential pregnancy. Progesterone then takes the lead, promoting a secretory environment that supports embryo implantation. Estrogen also influences cervical mucus, making it thinner and more slippery around ovulation, which helps sperm swim toward the egg, boosting fertility. It also keeps vaginal tissues healthy by maintaining their thickness, elasticity, and lubrication, which is important for comfortable intercourse and overall sexual health. Throughout the cycle, fluctuations in estrogen can affect how you feel. For example, estrogen peaks around ovulation are often linked to increased libido and mood changes. Conversely, as estrogen levels decline during perimenopause and menopause, women may experience symptoms like vaginal dryness, mood swings, and irregular periods. Understanding how estrogen works helps explain many aspects of menstrual health, fertility, and sexual well-being. It's important to remember that individual experiences can vary widely, and if you have concerns about your cycle or hormonal health, consulting a healthcare professional is always the best step.